Hi, I'm Dia. I'm going to be a nurse today. I'm going to be performing a physical assessment for my nursing class.
Okay.
It's going to go on YouTube. Do you have any questions?
No.
Okay. And we'll get started. That we cannot do here at home is checking your height and weight. Weight, you basically stand on a scale and it will tell you how much you weigh. Height-wise, you have a measuring tape or something else and it will tell you how much tall you are. Your temperature, turn to the side. .5. We'll be checking your heart rate. Okay, about 72.
For respirations, I
About
got
16. The lumbar test. Can you stand up? Okay. Stand straight. Close your eyes. Don't move. Okay. Ask you a couple of questions, okay? How old are you?
I'm 18.
And what's your gender?
I'm female.
Okay. Can you tell me wherever you are right now?
We are in Belleville, Pennsylvania.
Okay. And do you know what the date is?
December 8th, 2018.
Okay. Do you know when your birthday is?
November 5th, 2000.
Okay. And what color is the sky?
Sky is blue.
Okay. In a neurological assessment, I want you to touch my finger with your finger and then touch your nose. Okay? Assessment. The first thing I'm going to do is look at your hair. Okay. It's clean with a fine texture. There's no infestation of any bugs. 2 ears. Okay? Turn sideways for me. I'm going to see if I can see anything in your nocturnal ear. Let's move to the other side, please. Everything's clean. I don't see any lesions or redness. I'm going to palpate behind here to your mastoid process. Palpate your pinnas, your tragus. Okay. 2 other tests that I do not have the equipment for. There's something called the Ritter test, which is when you take a tuning fork and you put it on the top of your head and it tests whether you have sensory neural conduction hearing loss. There's also the Weber test, where you take the tuning fork and you hit it and it goes in the front and in the back, and then you would tell me exactly which one's louder or softer, and it helps distinguish what kind of hearing loss you may or may not have. Now I'm going to be checking for carotid burets. Put your head forward, straight for me. Okay, hearing. To the other side. I don't hear any either. Just gonna check at your eyebrows, lower lids. I don't see any lesions or discharge. Globes of clearance or just sclera. Averting your eyelids so I can see what's going on underneath. Okay, pink, no redness, no lesions. Other side. Okay. Same thing bilateral. We're going to be assessing how long you can see with the Snellen eye chart. Okay, that goes about 6 feet away. Can you read the smallest row? You can read from there.
FELOPZD.
Okay, you have 20 out of 25. In the 6 cardinal positions of gaze, I want you to follow my finger, okay? With your eyes. Okay, all within the normal limits.
Ooh. Okay, so that's done.
Okay, mirror image me. And let me know when you see, no, look forward. Let me know when you see my finger.
I see it.
Okay, the other one. Let me know when you see my finger. Ready? Look straight ahead.
I see it.
Okay, I'm going to be checking your corneal light reflex and just seeing if there's any like abrasions on the cornea. I don't see any. I'm going to be checking your pupil response. I'm going to dim the lights. And look straight ahead for me. Your pupils are equal, round, and reactive to light. That you could do for the eye, which you don't have the equipment for, is using the ophthalmoscope. It checks the ocular fundus, which basically you shine the light into your eye, and I'd be able to see the vessels in your eye, and then be able to describe where they are in relation to each other, how big they are, assessing your neck. Feel around here for any lumps or bruises. Check your lymph nodes. Okay. Gonna check your trachea. It's midline. Checking your range of motion for your spine. So if you can move your head back and forth. Okay, now put your ear like this. And to the other side. Okay, and then chin to the front. Back and then front. Okay. I'm gonna be checking your thyroid. So can you bend your head slightly forward? Forward. Okay, I'm gonna stand behind you. Remove your trachea off to one side. And can you grab a sip of water, please? Okay. I don't feel your thyroid. Go ahead. Other side. Okay, good. Don't feel not that either, that's normal. Apical heart rate and rhythm. That's been normally. Okay, about 68. Everything sounds normal. I'm going to be assessing your heart. I'm going to listen to the aortic valve. Heart sounds strong. I don't hear any abnormal sounds. What I'm going to do is identify the angle of Lewis. So if you could pull your shirt up. Okay, angle of Lewis is here. Okay. The suprasternal notch is up here. And your C7 is the last vertebra in your neck right before you hit your spine. I'm going to be testing your lung sounds. Breathe in for me. Breathe out. In. Out. Again. 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 Okay, now I've got to do your back then. Can you turn inside? Hey, same thing, ready? Breathe in. Again. Okay, your lung sounds clear. And they're symmetrical on both sides. I don't see any abnormal respiratory issues. Okay, I'm gonna palpate your chest bone. See if you can feel any lesions at all. Okay, everything feels good. Lung feels. Basically, that means I'm gonna be tapping around here for a sec. Okay, turn sideways. Doing something similar on the back. Okay. Don't need to hear any hyperresonance joints, any deformities, or swelling or redness. I'm going to be teaching you how to do a self-breast examination. What you do is you grab 3 fingers, okay, make little circles, and you go in a motion like this, like an S motion, down, okay? See if you can feel any lumps or anything abnormal. Also, you're going to check visually, so you look in the mirror, put your hands on your hips, and you hunch your shoulders, and see if you can see anything there too. Your upper arms, okay? Looking at the color looks uniform. Bilaterally, don't have any lesions or swelling. Temperature-wise, cold, but it is, cold outside. Gonna check for pulses bilaterally. Make sure you're getting blood flow. You're testing some of your joints. Can you fold your elbow up and bring it back down? Okay, now do it again. I'm gonna give you some resistance. Okay. Other side. Okay, same thing. The last night go like this and then go that way. And out. Okay. Okay, now put your hands and put them behind your back like this. Right in the nook. Okay, good. Now bring it up. Put it behind your head like this. Okay. Just relax your arm. Let me know if you feel any pain. Okay, I'm gonna be checking your range of motion for your hands. Okay, so can you flex your hands or bring them down? No, but you don't need, yeah, there we go. And then up. Okay. Now fist. Okay, now touch thumb to pinky. Thumb to pinky. Neurological test. Can you grab your hands? Okay, now put them both in like this. You feel any pain? Okay, strengthen your hands. Can you grab my first 2 fingers? With your hand, not your fingers. Yeah, and squeeze. Okay. Both are strong and equal bilaterally. Okay, can you lie down on the table for me? We're going to be looking over your abdomen. Put your shirt up here. Color's good. Skin form to touch. No lesions. Open skin wounds or redness. Stomach symmetrical on both sides. And all 4 quadrants for bowel sounds. Okay. Bowel sounds on all 4 quadrants. None of them are hypo or hyperresonant. I'm gonna palpate all 4 quadrants. Let me know if you feel any pain. to check for tympani. I'm going to be tapping here. Lower legs. Once again, assessing for color. Uniform. No lesions. Bruising. Very little hair growth. Skin is slightly cool. Gonna be feeling your popliteal close on both sides. Now I'm going to check to see if you have any edema.
In the joints of the knees, the ankles, and the feet.
Yes? Okay. You need to lift your leg, bend it. Not too much. Okay, now let me know if you're going to flex it in. Let me know if you feel any pain, okay? Okay, same the other side. By the pose is stressed. Gonna lift, flex your hip, and I'm gonna push down on your thigh. Let me know if you feel any pain. For DBT, by checking for the Holman sign. So if you can lie down on the table. Okay, gonna extend this leg and point your toes towards you. Gonna squeeze your calf. Let me know if you feel any pain. Okay, I'm gonna try the other side, the same thing. Extend, flex. I'm going to be assessing your joints and muscles. Let's do your feet, okay? Can you flex your toes towards you? Both of them. Okay, now flex them down. Bring them both into the center. Bring them both out. Okay, now flex toward you. Okay, flex down. Okay, choose excellent foot strength. Ready? Okay, we're going to check for sensation in your feet. This is the Babinski test. I'm going to run this pencil from your heel to your toe to elicit a response where you flex like you did. Okay, in addition to these different tests, I've also been assessing you the whole time you've been here. So your gait is normal. You don't have anything. You walk steadily. Don't have trouble with balance. Facial expressions match your mood. You're generally happy and quick to answer questions. You speak clearly. I can understand what you're saying. You're dressed appropriately for a physical assessment. You're clean, personal hygiene-wise. You have a mostly straight posture, a little hunched over. And your facial features are symmetrical, and you don't have any physical deformities.